Morning. Today we're going to be talking about the different stations set up at births. Now, these are kind of universal, but your midwife might do this somewhat differently. Now, when you get to a birth, the first thing you want to do is note how mom's doing and the time you guys arrive. You can add this to the charts later. Sometimes if it's really slow, you can just pull up the chart before setting up oxygen, but if things are clipping along, then you'll definitely want to set up the oxygen station first. So making sure that there is a T-piece or ambu bag set up with a mask attached to the oxygen turned on, and having like a pulse oximeter close by. Now, this might vary a little bit. You'll want a heating pad or some kind of like warmer for set up nearby where the birth is going to happen in case you do need to move baby, and then some kind of sheet pan or something that you can put the baby on that's a flat surface if you need to. And then you'll also have other things like a bulb syringe, a dilly, different suction devices, things like that should all be together nearby and easily accessible if needed. And you can cover it with like a blanket or a Chucks pad or something so that it's not at the forefront of mom's mind when she's in labor land and needs to focus. So that's probably the most important station. And then you'll go about making sure you have your medications nearby on hand. If you have Pitocin pre-drawn, you'll want to keep it in your pocket if you're the primary assist. But just make sure you communicate it to whoever's the primary that you have it, or hand it off to whoever it is if you're just the one charting and setting up the stations. And that you have Cytotec, Metrogyl, the needles, TXA, and whatever goes along with that handy. It's also great to have the placenta already set up. This can be like a later thing depending on where mom's at in birth. If she's clipping along, you'll want to hurry it up. But have a placenta bowl, the cord clamping instruments, cord clamp, or like a band, or however your midwife does it, and just have it in a bowl tucked away somewhere where you can grab it after baby's born. You'll also want to have the trash and laundry set up. If it's just a couple big black trash bags, you'll just want to put it somewhere where it's easily accessible, but not necessarily in the way of people. Or if you have like these kind of like blow up laundry baskets or fold up laundry baskets that you can just put the trash bag inside of so it's easy to move around, then that's a great option too. They're really lightweight. And I think that's everything. So blessings to you on your midwifery journey.